Thank you, Joe. It really is a pleasure for me to be here this evening and to, on behalf of the Joint Commission, add my note of welcome to Joe's to the Patient Safety Summit of 2014. Why is the Joint Commission co-convening the summit, this particular summit? I expect most of you know the Joint Commission's core business. We establish standards for safety and quality for a wide variety of healthcare organizations. We send teams of surveyors out to those organizations to help them find opportunities to reduce patient safety risk and improve quality. And right now, we accredit almost 21,000 hospitals and other healthcare organizations in the United States, and our international program is operating now in more than 60 countries around the world. But today, we are more than just an accrediting organization. We are also an improvement company. As we listened carefully to our customers over the last number of years, it was clear that they had an overwhelmingly consistent message to us, whether it was from CEOs of healthcare organizations, physician leaders, nurse leaders. The message was, stop telling us only about what the problems are and start helping us find solutions that are lasting and effective so we are not beating our heads against these quality problem walls every day, day after day. We know from our international work that the same quality problems that we have been struggling to overcome since the patient safety movement was galvanized, as Joe mentioned, by the IOM reports about 14 years ago, the same problems, whether it's hand hygiene noncompliance, wrong site surgery, operating room fires, failures of communication in transitions of care, all of those problems are global. Every developed healthcare system in the world, no matter how it's organized, no matter how it's financed, no matter what the balance is between public and private healthcare, every developed healthcare system faces exactly the same quality and safety problems. There is no organization or country out there that has the answers to how to get rid of these problems that we have been struggling so mightily against. So about 5 years ago, the Joint Commission created the Center for Transforming Healthcare as one of our component parts. We're not-for-profit, all the components are. And the job of the center was to bring new and more sophisticated problem-solving tools and methods to see if we could make a bigger dent, and indeed to get rid of these quality and safety problems. And you'll be hearing more about the solutions that the center has started to create, and I believe you will see that they have started to make a much bigger difference than what we have been working with so far. But no single organization, no matter how large, small, effective, can do this job by itself. It takes a community of partners to make the difference that we want to make. And so when Joe and I started talking about partnering in this effort, I was delighted to be able to find a new venue for partnership with medical technology companies, with patient safety advocates, hospitals at the leading edge of improvement, and add our modest efforts to that partnership as we all try to get to this goal of eliminating preventable deaths, eliminating harm by 2020. So thank you for your participation. I look forward to meeting more of you over the next 2.5 days and working with you in the days, months, and years to come to reach this goal. Thanks very much.